Hello everyone. Today I'm going to discuss type 2 diabetes mellitus as for my final video presentation for my pathophysiology class. The definition of type 2 diabetes mellitus is a heterogeneous condition that describes the presence of hyperglycemia in association with a relative insulin deficiency. There are strong genetic components associated with type 2 diabetes mellitus. What this means is that a person who has one or more parents that have type 2 diabetes mellitus are more likely to get it and are at a greater risk of developing type 2 diabetes mellitus. There are also metabolic abnormalities associated with the disease. This includes insulin resistance, which is a decreased ability of insulin to target tissue. Patients that have type 2 diabetes mellitus can have high, low, or normal insulin levels. Another abnormality is deranged secretion of insulin by pancreatic beta cells. And the last abnormality is increased glucose production by the liver. The classification of type 2 diabetes mellitus is insulin resistance with relative insulin deficiency. There are specific types of type 2 diabetes mellitus, like genetic defects of beta cell function, genetic defects in insulin action, and drug or chemical induced. Type 2 diabetes mellitus can be further classified using fasting plasma glucose. Type 2 diabetes accounts for 90 to 95% of diabetes cases, and it usually occurs in patients after age 30. The etiology for type 2 diabetes mellitus, it's insulin resistance that stimulates increase in insulin and secretion as the beta cells attempt to maintain normal blood glucose levels. Increased demand for insulin leads to beta cell exhaustion and failure. This results in postprandial blood glucose levels and eventual increase in glucose production by the liver. Insulin resistance is typically associated with obesity and physical inactivity in patients. The syndrome that type 2 diabetes mellitus falls in is metabolic syndrome, where it's insulin resistance that causes metabolic abnormalities like obesity, high levels of plasma triglycerides, low levels of high-density lipoproteins, hypertension, systemic inflammation, abnormal function of vascular endothelial, and macrovascular disease. A major factor of metabolic syndrome that can eventually lead to type 2 diabetes mellitus is obesity. Some clinical manifestations of type 2 diabetes mellitus include polyuria, polydipsia, obesity problems, blurred vision, fatigue, and skin infections. There are a lot of diagnostic tests for diabetes in general. Some of them include fasting blood glucose. Glucose levels are measured after food has been withheld for about 8 hours, and it's tested through a blood test. Levels above 126 milligrams per deciliter of glucose are typically diagnosed with diabetes. Another test is capillary blood glucose, where you prick your finger and the blood that you get from pricking your finger will go onto a little strip, and then it will be electronically examined to see what the blood glucose levels are. You'll see a lot of people who currently have diabetes will be using this just because it's very convenient for them to easily prick their finger and have their little electronic machine read out what their blood glucose levels are. Another diagnostic tool is urine glucose exams. This is not typically done too much anymore. People tend to stick with the blood glucose levels instead. Oral glucose test is also used. This measures the body's ability to store glucose by removing it from the blood. In people with diabetes, the blood glucose will rise and remain very high because of the lack of ability to respond to the increase in glucose. People without diabetes, the blood glucose will drop in about 2 to 3 hours because their body can respond to the increase in glucose, whereas somebody with diabetes, it cannot. The differential diagnosis for type 2 diabetes mellitus is patients are typically obese. They do not have a complete deficiency of insulin. Remember earlier I said that most can have high, low, or normal insulin levels. There is not a complete deficiency of insulin. And they typically will not have a ketoacidosis. This is typically in type 1 diabetes mellitus. There can be chronic and acute complications to diabetes. Some of these complications include hyperosmolar hyperglycemic state, which reduce glucose utilization and increase hepatic glucose output. This pulls water out of the body and causes dehydration. Neuropathies, these can be due to long-term hyperglycemic states. They cause thickening of the nutrient vessels that supply the nerve, leading to vessel ischemia. Also, demyelination can occur that affects the Schwann cells and slows nerve conduction down. Retinopathies that can also occur, these can cause vision loss or blindness. Foot ulcers are also very typical in people who have diabetes. They can be severe enough to cause ulceration, infection, and can be even more severe enough to cause an amputation. Foot ulcers represents the effects of neuropathy and vascular insufficiency. There are a lot of different treatments for diabetes, some for type 2 diabetes mellitus, dietary management, and exercise. This goes back to a lot of people who have type 2 diabetes are obese, so this can help with weight loss and to manage what their diet is. Sulfonylureas, this is a drug that helps to reduce blood glucose by stimulating the release of insulin. Alpha glucosidase inhibitors, this delays carbohydrate breakdown. And thiazolidinedines that help with insulin resistance, which is the major cause of type 2 diabetes mellitus. Thank you for listening to my presentation, and I hope you learned a lot about type 2 diabetes. Thank you.